the probability that it will give you 100% coverage is 100%. But ABC of preventions are still primary, while biomedical preventions are just next to that. HIV is a disease that has no cure, and so the best way to avoid it is prevention. And we have ABCs of prevention: abstinence or avoiding risky behaviors, be mutually faithful to your partner, then consistent condom use. But in addition to that, we now have what we can call a D, drugs, biomedical prevention. So Lenacapavir is one of the biomedical prevention. It is a medication that is given via injection. It's an injectable, and it tends to protect the body from getting infected for a period of 6 months. Then you renew it after 6 months. The efficacy, and in simple language for those that want to understand, the probability that it will give you 100% coverage, let me use those simple words, is 100%. But like I said, ABC of preventions are still primary, while biomedical preventions are just next to that. So once you can do this, and it's not the only injectable, there are other injectables like cabotegravir, but Lenacapavir itself, popularly called Len, is a drug certified by WHO July last year, so it's less than 1 year, and Nigeria is already benefiting from that. You know, Nigeria reported the first case of HIV in 1981, and for over maybe close to 20 years, 2001, there was no treatment. So maybe trial drugs, but real treatment started much later, maybe 2004, 2005 and above. And we've been having modification of those treatments to what we call ART, now highly active antiretroviral therapy, which is a combination of 3 drugs. So now, we've moved Nigerian treatment, those living with HIV, as of today, at least, let me say the percentage, about 95% of those that know their status are on treatment. So the best way we can control the epidemic now, finally, is to reduce new infection. Lenacapavir and other methods I've said earlier, like behavioral change, the ABC components and the rest, we tend to reduce new infection. So those that are already living with the virus are undergoing treatment and they will live normal life. Those that have never been infected but are at risk of being infected, they can use Lenacapavir and other pre-exposure prophylactic drugs. We have the oral ones and we have the injectable ones. The oral ones are taking pills, they call them pills, daily. While the injectable ones are, for now, is either once in 2 months or once in 6 months. Lenacapavir belongs to the group of once in 6 months. Let me start by saying, based on our guideline in Nigeria, that's the starting point, which is, of course, approved by the Coordinating Minister of Health and Social Welfare. NASCA leads the preparation and the documentation of national guideline. Based on that, the use of prophylaxis as, should I say, eligible populations. The first criteria is you must be at risk. You can't just say because you're a teenager. You may be a teenager, you may be an adolescent, you're not engaging in risky behaviors. You don't need it. You may be a teenager that is purely, you are not on injecting drug, right? You don't have a partner that is positive, you are negative, so you are not eligible. So regardless of the age, once you are at risk, you are eligible. And so we call the general language people at risk of getting infected. So it's not a function of age, it's a function of are you at risk or not. So based on that, it is available. And the truth is, Lenacapavir has come, and I've seen a lot about human behavior. Before, when you ask somebody, do you want to know your HIV status, they will be wondering. Or if you say, okay, fine, let's test you, there are drugs for HIV, you see them fidgeting. But now, people are coming to meet us to say, fine, we need the drug. So each individual in Nigeria, in the world, that's the truth, knows his or her risk status. But they will not display in public that I'm risky, that I'm doing this, every night I carry this. They won't tell you that. But now people are coming to ask us that where can we get these drugs from? So in the real sense of it, the demand will be very high, maybe higher than the supply. currently, I will start by saying this drug, the quantity we have in Nigeria now is catalytic. It means something, for those that did chemistry, those days, catalyst, something that fast tracks a reaction but does not take part in the reaction. So it's a catalyst in the sense that we are going to have substantial amount to roll out for the country, and the quantity we are going to have currently is going to be able to serve some demands at the state level, 8 states and Federal Capital Territory Abuja. We are going to distribute this based on their demand needs and key population size or people at risk size. And for now, because it's catalytic, it is free. We don't have any plan for now to commercialize it. We don't have any plan for now for people to buy it up the counter or on the counter. But there's something that I know is key. The only company that has the license currently globally is the one producing it. But the idea, the agreement between that country and a lot of stakeholders and international bodies is that they are going to liberalize the license for other people to produce. So we are going to have huge quantity in the next 3 to 4 years, because the drug is actually 1 year old, less than 1 year old. So the company that is still primarily producing it is rationing it across all the countries that need them. The same time it's coming to Africa, at the same time it's going to Europe, the America. So based on the quantity available, it's going to be distributed to selected hospitals in our database that have capacity to provide subcutaneous injections and storage facilities for what we currently have. It's free for now, but we can't say what the future will be like, but the minister and the other stakeholders will decide on the framework, if it's going to be a total market approach or not. But currently it is free, supported through the Global Fund for the country and other countries in Africa. So we have a list of where it will be available in Nigeria, the 8 states and Federal Capital Territory. I know for sure it's going to be available in Asokoro General Hospital in Abuja, because the launch we did factored Asokoro as part of our primary site of first injection. So we have a comprehensive list that we've made under our IEC, information and communication materials, that people can easily access. Then we have phone numbers 62222 as the dial number to tell you the specific place you can get it. So it's a collaborative approach. NASCAP, NACA government, IHBN is private, APIN is private. We have a couple of organizations that work with. CHI is involved, Clinton Health Access Initiative. They are part of the key groups that are doing the price reduction, because even though it's free for people, a company is producing it, they must sell it. So some people are paying for it, someone is paying for the launch. But in the real sense of there's no free launch, someone is paying. So for you to know what you will pay to get efficiency in your spending, CHI and some other organizations are part of those that are working on the pricing to reduce it to what people can buy, because the profit for the company will be in the volume. So the approach is increase the demand and the price will fall, but not on the clients, but rather from the company and the donors. So there's a collaboration between the pricing system, the community system. So some of these non-government organizations are working more with the community system to ensure that they adopt and they use. While the government is creating the framework for that, the interaction with the organization that will be bringing them in, the pharmacovigilance means tracking of if there's any side of adverse effect. NAFDAC is also working with us. Guidelines, NASCA is developing the guideline. NACA is working closely with us on that. Then issues around delivery. Some of these hospitals too, some are parastatals like FMCs. So they are doing the delivery, that's the injection itself through a framework. We have an M&E system, we have IHVN also supporting part of the procurement. So we are working as a team. It's not just the government, but government is owning, leading it for the people of Nigeria.